Okay, timer is on and here is the question. Right, if you have read and understood, kindly begin your station.
Yes, hello. Hello, I'm Farah, one of the surgical trainee working for Mr. Mann. I'm calling to speak to Mr. Max to ask him an advice about a patient who has underwent right hemicolectomy for sickle tumor and has been oliguric now. Could I check to whom I'm speaking to?
Yes, I'm Dr. Mr. Max speaking here.
Okay, Mr. Max.
Can you please tell me who's the consultant of your case?
Mr. Mann.
Okay, great. Summarize your case.
Okay, Mrs. Jane, 69 years of age, was admitted, operated 24 hours ago for right hemicolectomy for sickle tumor. And he has been oliguric last 8 hours. Her urine output is 10 to 20 ml. And I also checked the urinary catheter. It was not blocked. Clinically, he is tachycardic and my hypotensive, and her temperature is slightly raised. And on examination, her blood shows that hemoglobin dropped from 12 to 10, and urea is moderately raised, and creatinine is also slightly raised, borderline high.
Okay, so what do you think? What might be the cause of his low urine output?
I think she is dehydrated, as she received only 1100 of normal saline in her post-operative day, and there was a blood loss, but he received 2 units of blood.
Okay, so you checked that from the notes, he was having blood loss up to, you said something like that. You checked from that notes? Is it there in the operation notes?
Yes, she received 2 units of blood during the surgery. Yes, I checked on the notes.
Okay. So what's your plan of action right now?
I will start fluid resuscitation by giving 1 liter of normal saline within 1 hour, and we'll repeat his blood tomorrow morning to see whether the hemoglobin is dropping or not. If so, then we'll give blood transfusion, and also we'll continue to monitor her vitals. And if she does not respond to the fluid challenge, then I will transfer her to the high dependency unit for monitoring of the vitals, and also we'll do the CV line.
Okay, have you considered about transfusing blood or not? Should you transfer the blood or not?
I will check the hemoglobin next morning, and if I see that there is dropping of the hemoglobin, then I will consider blood transfusion.
Okay, so is there a possibility that this patient is bleeding from inside? Is there a possibility?
It could be. I'm checking. I will check. I will do the continuous abdominal examination and monitor. Right now, her abdomen is lax, but I will also will arrange for abdominal ultrasonogram.
Okay, great. So is there a possibility that this patient is suffering from anastomotic leak, as you told me that this has been operated for right hemicolectomy and anastomosis has been there? Is there a possibility of anastomotic leak as well?
Yeah, it could be, but right now abdomen is lax, and I will do serial abdominal examination and also arrange for abdominal ultrasonogram. Then we'll let you know if there is intraperitoneal collection present.
Okay. So do you think I need to come back to see the patient?
I will start fluid challenge and I will let you know if anything comes up.
Okay, thank you very much. Keep updating me, okay?
Ask
Thank
about
you
the
very much.
dose.
Yes, ma'am.
Dosage of hydration. You said you will give the fluid
Okay,
challenge.
so how much fluid you will give in this patient?
Okay, I will I will start 250 to 500 ml of normal saline within 15 to 30 minutes.
Okay, so if he does not respond, how many fluid changes you will give before proceeding to the shifting to him high dependency unit?
Good.
1,000.
Okay, so who do you if patient is deteriorating, okay, so you would like to involve any other department, any other doctor in this in the management of this patient? Hello.
Hello, high dependency unit.
Okay, I mean, I was asking any other doctor other than other than your consultant, any other department, any other doctor you would like to involve, like anesthetist or anyone else?
Yes, I like to see anesthetist and urologist.
Okay. Okay, ma'am. I think that's.
Yeah, no. More. Do you think patient is in shock? Did you ask this question?
Yes, ma'am. I told him. Do you think patient is bleeding? And
Would you
she has
want to
answered it.
transfer the patient?
She
Yes.
already.
Okay,
Yeah,
She
I said
already.
yes. To high dependency
She
unit, yes.
answered. Yes,
Okay.
she already told me that.
Before she goes, ask her to summarize it, whatever you two have
Yes, ma'am.
discussed.
She has to, ma'am, summarize it. She has to summarize it from their side, ma'am.
From her,
I
Okay.
think,
she
ma'am.
has to do it, yes.
Yes,
So
ma'am.
your consultant in charge, order her to summarize it for you.
Okay. Can you please
Yes.
summarize?
Yes, sure. Mrs. Zain, 69 years of age, was operated elective right hemicolectomy for sickle tumor, and on her first POD, she developed oliguria, 12 to 10 ml of urine output for last 8 hours, and she has been tachycardic, hypotensive. Her creatinine and urea were borderline raised, and abdomen was soft, and she received only 1100 of ml of normal saline, and her urinary catheter was not blocked. She also during surgery lost 2 blood loss and received only 2 units of blood during the surgery. As patient is thinking dehydrated, I will start fluid challenge, and if she doesn't respond, then we'll let her shift to the high dependency unit for CV line and proper monitoring. And also we'll check her abdominal examination, and we'll arrange for abdominal ultrasonogram to see whether there is any collection presence or not. And if anything comes up, then we'll let you know.
Very good. One more, stocking and
Sorry?
Anticoagulant and stocking management, because surgery was
This
done.
patient is a case of yes, as ma'am has said, this is a case of malignancy, and there is a major abdominal surgery has been done.
Yes.
What kind of measures you will take for the antithrombotic measures?
Okay.
Yes. Or prophylactic measures would you take?
Yes, ma'am.
That's okay.
Very good. Okay, this you should tell. And
Okay,
at the end, yes, if anything happens, then the consultant will come and see the patient.
Yeah.
You, I think, still have some. Yes, now it went. The moment I was.
Yes, ma'am.
Okay. Very good. Now bell went. All right.
Yes.
Please give honest and sincere feedback, Dr. Ishfaq. You begin.
Yes, ma'am. Except from the summary part, she has
Yes.
for the first time, like she has presented this case, she has done very good. Nice,
Yes.
I must say, ma'am. Yes. The rest you'll take
Yes,
care
but
of it.
I would feel, I felt that she was little shy and reluctant. That's her first time
Yes, ma'am.
presenting
That's true.
communication skill, but she did history taking yesterday, so we have to consider she did comparatively better yesterday. But then
Yes, ma'am.
we know she can improve. Like
Yes, ma'am.
to talk more, in order to talk more, you have to go back and read more, so that
Yes.
you take more time than the consultant asking you question. Okay.
Questions. Yes,
Yes.
that's right, ma'am.
Yeah. So you have to go and read the scenarios so that you are familiar with the scenarios, and then you have to learn extra vocabulary to talk more, take more time,
Yes.
and comprehend everything, yes, within the time. So at least like I was talking, but still I can say you had plenty of time at your hand. All right,
Yes,
can
ma'am.
I
Exactly.
request Dr. Ulfat to give feedback, please? Because she has been helping
Yes,
you,
ma'am.
so yes, please.
Ma'am, firstly, Dr. Farah, it was really nice. I
Yes.
mean, you did good for the first time in a communication skill. And regarding, yes, ma'am, you are right. The whole thing, whenever you're answering, answer it to the point because you want the examiner to ask you more questions, right? So keep it, and also summarize at the end from your own accord. Like, don't wait for the consultant to ask you to summarize it. That way, that is one thing. And yes, ma'am, I think practice. I think if she
Yeah,
practices a little
she'll
bit
be
more,
good.
she'll get
She'll
it.
be good.
Yes,
Yes,
ma'am. Yes, ma'am.
hopefully.
I
So
feel,
good,
yes,
Dr.
ma'am.
Farah. Well done.
Thank you.
Anyone
I
else
think,
want
I
to
will
ma'am,
give?
keep it in
Yes.
mind.
Yes, please.
yes, ma'am. Yeah, that's what she'll have to practice a bit, then she'll be fine. But for the first time, it's good, ma'am.
It's good. Yes. Thank you so much.